All right, we're going to get started. It's 8 o'clock. Welcome, everybody. We're going to have a lot of people today. I'm really excited about this. We're going to be talking new tools for old problems, specifically NPAIDs, non-pharmaceutical anti-inflammatory devices. All right, so just so you guys know, as we get started, you guys have the ability to ask questions. I'm not going to be answering them in real time because I'm going to be talking through the webinar, but please write all your questions in the question format. If you go up to the top of your bar, or it may be at the bottom, depending upon your computer, you'll see Q&A. All the questions will get written down after the webinar. Assisi will send all of the questions to me. I may group some of them, so they may not be in exactly the same words that you asked, but we will get all of your questions answered. And then when you fill out your evaluation at the end, you'll have the ability to mark it off that you want all the answers. And then we'll send you an email with the questions and answers. So you'll get all your answers. Let's start talking about what we do, right? What's the veterinarian's jobs? Our job is, one of our main jobs is to treat pain and inflammation. And there's times that the meds aren't enough. We can't give the meds. Maybe the clients don't want to give meds. There's lots of times that we just need more. And there's times that we don't even think maybe we need them, and we really should have them. Inflammation itself may be not the same as pain, but certainly inflammation itself can cause pain. And by getting rid of inflammation, we can help decrease pain. All right, first poll. What I'd like you guys to do is let me know what you do. So how do you control your inflammation? Do you use NSAIDs? Do you use pain meds? Do you support the tissue, like if you have inflammation in the kidneys or the liver or the ears, to help support the tissue itself? Or do you think, you know what, inflammation is a normal part of healing? If you guys can check off your boxes, we'll get an answer in just a minute and see what you guys say, and then we'll keep going. All right, the sooner you guys can pop in and mark off those answers, we can get them all together and take a look at it. There we go. So it looks like a lot of you guys are using NSAIDs, great. Pain meds. And most of you are treating inflammation. Perfect, excellent. All right, we'll get rid of that and keep going. Let's talk about inflammation. I know when I thought of inflammation, I would think, oh, there's inflammation, so that may be causing some pain, it's putting pressure on stuff. But there's so much more when we look at inflammation. Inflammation is fluid in the tissue. So think about this, at every nerve ending, we need neurotransmitters to go across the synapse. When we have inflammation in that tissue, it actually dilutes the neurotransmitters. So just by having that fluid, we're actually decreasing the nervous system's ability to send messages up to the brain and back to the tissue. At the joint, we all think of inflammation, oh, as there's going to be increased degenerative joint disease, but what we have to think about is the joint capsules themselves get inflamed, so that creates stiffness. The cells that create inflammation in the joint are on the inside of the synovial capsule. Those cells create inflammatory mediators. The inflammation in the joint, we all know that it thins the joint fluid, but it actually breaks up, the inflammation breaks up the matrix. So what we think of as bottle brushes get smaller and smaller into pieces, and then the cells themselves can't make big ones. We have tissue that comes in and takes up space in the joint. So there's a lot more than just thinking of, well, we're going to have some inflammation in the joint. Anytime you put your fingers on a knee and you feel a fusion, or any joint that you have a fusion, there's so much being affected, not just the cartilage. And I want you to think about inflammation is not just joints, right? If we start here, we think about hot spots, that's pain. Think about having a wound, right? The pain is from the inflammation. We may see the dog scratch. It's not them just saying, I'm itchy. It hurts. Think about ears, right? Every time you pick up an ear and you see it's red and it's thickened, there's pain associated with that. Certainly anal glands, we see the dog scooting. They're not scooting because it's itchy. There's inflammation and pain associated with that. Not just when they rupture, but just anytime you see a dog scooting, it hurts. They're trying to rub it. They're trying to express it. Think about in the mouth. Anytime you lift a lip and you see inflammation in the gums around the teeth, that's discomfort. That can be uncomfortable for them. Think of pancreatitis, right? We have inflammation in the pancreas that's creating pain. We know these guys don't eat. Part of it is because they're nauseous. Part of it may be abdominal pain. We can have inflammation in the kidneys. So we want to do things when we have disease in the kidney to increase perfusion, decrease inflammation, so that we can have it function to the best of its ability. We can have inflammation in the lungs. Breathing's important, right? Getting oxygen into the blood. Anything we can do when they are having difficulty to help that is beneficial. Laryngeal paralysis, that's a huge one. These guys that have LARPAR, they can have what we call breathing episodes. Inflammation, not only can it be uncomfortable, it can make it difficult to breathe, which is a scary fear-based thing. Having something that you can immediately decrease that inflammation is a great gift. Any dog with LARPAR should have. So what are we going to be talking about? Non-pharmaceutical anti-inflammatory devices. The two we're going to talk about tonight are laser and PEMF, or pulse electromagnetic field therapy. We use these both for inflammation and pain. We're going to go through some research, and it's really, really important for me to let you guys know I am not a person who just uses this stuff. It's part of a multimodal approach. Better living through chemistry should be going through all of our minds, but there's so much more than just drugs. I can remember years ago going journal after journal after journal thinking, okay, we have to be able to treat my patient's pain. I can't control it with just what I'm using. And I'd see a journal and I'd pick it up and it's like, oh, new ways to treat pain, drugs. New ways to treat pain, drugs. Well, I am so happy to be able to bring you the information that there is more than that out there. All right, let's see what you guys are doing. How many of you guys are using laser, PEMF of any sort, thermography, all of them or none of them? So again, if you guys can pop in your answers quickly, we can keep going. All right, great. So a lot of you guys are using laser. About half of you right now are, or maybe a little more, are already using PEMF. Thermography, right? Great way to see the inflammation, at least if it's close to the outside. And some of you guys aren't using any of it. So hopefully we'll be able to help expand your knowledge and help your patients. All right, so understand that I am not tonight talking about all the things that help control pain that are not drugs. It's specifically about anti-inflammatory devices. So what I'm not talking about is TENS, which can control the pain but not the inflammation. So it's not an anti-inflammatory device. Acupuncture, again, can control pain and inflammation, but it's not a device. Exercises and manual therapies are more techniques. So again, those are great ways to control pain and inflammation, or at least help with it, but they're not a device. So let's talk about our first device, laser. Laser is a great tool. I love my laser. It decreases pain, enhances healing. Best thing to know about laser is you want to use it to the best of your ability for what your goal is. So low doses of energy can increase ATP production and allow the cell to do whatever it needs to do faster, better, right? Which is a great thing for healing. High doses of energy, not so much. You may not increase healing, but you stop the cell's ability to produce ATP. And you say, well, why would I want that? Well, because if you have nerve cells that are firing and firing and firing, saying all kinds of pain impulses to the brain, we want to stop it, right? Then we can work on the healing, control the pain first. Something to think about is that laser and pimp both affect the nitrous oxide cascade. When we turn on that nitrous oxide cascade, the effect in the body lasts about 2 hours. So if you have the ability to use both, what you want to think about is you don't want to do them concurrently. You're not going to hurt anything, but you're not getting the best effect for the patient. You want to get all the effects of one and then get all the effects of the other. So you just wait 2 hours between modalities. A lot of times what that looks like is laser at the clinic and send them home with a PEMF device. Understand also your laser has effects deeper than just tissue. What you want to be careful is that you're not using your laser and your PEMF devices at the same time, because the laser itself, especially your higher power ones, may damage your PEMF device. And that's going to be important when we talk about having a patient on a mat, because we don't want to be hurting those. So gross effects. Beautiful thing about laser, it increases angiogenesis. So not only do we get the vasodilatation and we get immediate blood flow, but we get healing because we have more blood vessels being brought into that area. I have on here stimulates fibroblast development, but I want it to be really clear here. Low doses stimulate fibroblasts. Higher doses, things in our therapeutic range, actually stop fibroblast development. So again, use higher doses for stopping pain, lower doses for stimulating healing. Laser stimulates osteogenesis. Every TPLO, every fracture, TTA, anything that affects the bone, we want to be lasering. Make sure, because laser would be absorbed by metal, that if you have a fracture and you put a plate on it, that you're treating from the side that doesn't have the plate. If you're doing like a TPLO or a surgery that has a plate, but you're like, well, but the incision's on that side. All right, great. Treat the non-plate side to treat the bone, and then treat the skin with a much, much, much lower dose just to treat the skin of the incision. Other effects, wounds heal faster. There's a lot of studies that show it's about half the time. It increases the tensile strength of the healing tissue, and can even, if you have the right wavelength so that you're getting into the deeper tissue, have positive effects on the cartilage. We can actually stimulate collagen production, which is a great thing. So show me some studies, right? Love research. This is a 2013 studies, and there's several of them that look at what exactly it does for inflammation. Well, we know we have inflammatory mediators. We talked about it, the cells that produce them inside the joint being on the inside of the synovial capsule, but we have them also in other areas of the body. Some of our really important inflammatory mediators, COX-1, tumor necrosing factor alpha, interleukin-1, interleukin-6. Some of these can be decreased by laser. Actually, all of those can be decreased by laser. Also, we have PGE2 alpha, And understand that these can be affected both with high power and low power lasers. So whether you have a class 3 or a class 4, you can get these effects. You just need to be able to get into the proper tissue. Here's some more studies, 2016, 2003, looking at pain relief with laser. Significantly less pain than the sham at the knee. I always look for double-blind placebo-controlled studies. Those are like awesome. Reduced pain in canine patients with stifle osteoarthritis, right? We see those every single day. Reduction in neuropathic pain. Any of our nerve injuries, we should be using laser to help control pain. We want to affect our opioid production, right? So we know that we're dealing with all of these new laws around our opioids. If we can be doing something to increase endogenous opioids, we can be using less exogenous opioids. We have, with laser effects, effects on the peripheral nociceptive or nociceptors, or the receptors that affect pain. Also really cool with laser is that we can affect the nociceptor activation at the spinal level. So if we think about the 4 levels of affecting pain, with laser we're hitting at least 2 of them. Arthritis. Again, we treat arthritis every day. I throw this up here as I deal with arthritis in my fingers, and I really appreciate it. At the wavelengths in the 600, because fingers are pretty darn superficial, and in the 800 range, there are great results for treating arthritis in fingers. And again, I put it in here. It's better than NSAIDs alone, but even better results when combined with NSAIDs. So better living through chemistry definitely helps. Here's a human study looking at osteoarthritis, again in the 800 nanometer wavelength range at really low doses in humans, 6 joules per point twice a week for 4 weeks. So 8 treatments of 6 joules per point. Significant improvement in flexion, pain level, pressure sensitivity, circulation through thermography, right? Isn't that awesome? But circumference, that's huge. That means not only did they feel better, but they felt better, so they were more active, so they built up muscle mass, right? Really cool, low doses of energy, great results. Athletic inflammation. Here's a study looking at athletes that have a Achilles tendinopathy, right? So I don't know if you know this, but there's actually 7 different areas of the human Achilles, or common calcaneal tendon in the dog, that has no blood supply, right? So it's a lot harder to treat, right, than if we're treating a muscle or something that has a good blood supply. In this study, 52 humans either had laser and exercises or fake laser and exercises. And what they found with 12 sessions of 5.4 joules per session, so again, very small amount of energy in the 800 nanometer range, they had significant reduction in pain and inflammation. Great study. So if I have a laser, why would I want anything else? Well, because people can only come in so often, right? So even if you have a great client and they can come in 3 times a week for a couple weeks, they can't do that all the time. And why wouldn't we want it to be treating them at home, where they can be treated multiple times a day? And we don't want to treat them multiple times a day with a laser, certainly not long term. So understand also, both pimp devices and laser have a overlap of therapy, but they also have other modes of action. Some that are identified and some that are not identified. So we want to be able to treat our patients from, again, multimodal, right? Different ways so that we have the most pain relief. Other things is what happens if we have an animal that has a bandage, right? Or if they have a really thick coat and it's hard to get the laser in. Treating with a mat or one of the loop lounges allows us to have 8 to 10 inches of treatment right through that, right through a coat, right through a bandage, where we don't have to worry about it. The other thing is laser can have some side effects, right? And there's some contraindications that we don't have to worry about when we're using targeted pimp. And I'm going to explain targeted in a minute. So there are no side effects, no adverse reactions. In fact, the FDA cleared targeted pimp loops on humans with breast cancer, right? So I can't tell you that it's perfect for every kind of cancer, but at least we know from this study that that's an option, right? That we can't offer with laser. And if you ask FDA clearance, what's the difference between approval and clearance? Approval is for drugs, clearance is for devices. So what is it? What does it look like? So here's some pictures of Assisi devices, which are targeted pimp, where we have a field that looks like a barrel coming out 8 to 10 inches on either side. We can push a little button to turn it on and treat. So in this case, if the dog has cervical issues, we can be treating up and down his neck. In the case of the little dog in the red carrier, we can be treating almost, if not all, of the whole dog while he's in the carrier, so in a non-stressful environment. So, did this just pop up? No, not at all. This actually has quite a long history, so let's look at it. In the 1930s, they came out with a PEMF device that created heat. It's called diathermy. If you've ever been to an acupuncturist or a chiropractor and they put this light on your back, and you're like, oh, that feels kind of warm. It's kind of nice. That's a diathermy machine. Well, they used it and they found that it worked really well for healing wounds, healing pain. And then they said, well, that's really cool, but there's a lot of different variables. What happens if we play with these variables? And some scientists got together, and in the 1970s, they changed the variables and found that they could create something that was extremely beneficial for delayed and non-unit fractures. They called them bone growth stimulators. In the 1990s, a Nobel Prize winner looked at what happens when we increase short bursts of nitric oxide in the body, how it affected both vasodilatation and inflammation. And then some scientists, including Arthur Pilla, took that information and said, how can we create a PEMF device to have the most effect, the optimum effect on that nitric oxide cascade? When he found those variables, and we're going to talk about those in a minute, he created a device and he called it targeted PEMF. It had significantly more effect than other PEMF for pain and inflammation. If you see up in the right corner, this was from the original breast study where they had a active or sham loops for the patients. That was great that I could get that picture. All right, when they got its FDA clearance with this targeted PEMF, one of the really cool outcomes was that there was approximately a 50% reduction in opioid use for the active loops versus the sham loops. They had such an effect that these devices were actually covered by Medicare, right? That's really cool. The targeted PEMF also, in all of the studies, when you look at PEMF, have had no adverse effects or side effects. So what effects do we know, right? What's the mode of action? Well, what's been shown in targeted PEMF is that you have an increase in calcium and calmodulin binding. And when that binds to endothelial nitric oxide synthetase, you get short bursts of nitric oxide. So what does that do? Well, that is a messenger that creates vasodilatation and lymph flow, so we have decreased pain and edema, and that happens in seconds from when we turn it on. But it doesn't just do that. We actually have a whole cascade reaction. So we have increases in cyclic GMP, and that effect actually lasts hours to days. We have increased vascular endothelial growth factors, fibroblast growth factors, and transforming growth factors. And those effects don't just happen now, they can take hours to days and even weeks to continue to work in the body. So remember I said there's lots of variables? Here they are. So variables that we look at: carrier wave, how is it getting through the tissue? Pulse width, pulse frequency, duty cycle. One of the major differences between diathermy and the devices we use now is that diathermy was on continuously. These devices that we use now when we look at pimp is on for a very short amount of time so that we're not creating heat. We look at the peak induced magnetic field, form factor, and I know that's kind of like a weird one, like what is that? The form factor is what actually creates the therapeutic shape and the volume of how much you can be treating. Treatment time and the effect per treatment time. We're going to look at cool studies in just a second. And the amount of area that you can be treating. So some of the variables that we look at with the Assisi loop or targeted pimp is peak induced magnetic field, 5 microtesla, 2 millisecond pulse width, and 2 hertz, so 2 pulses per second. So what does that mean? It's the difference between a bone growth stimulator. You can see you have a small amount of pulse intensity. You're bigger down here. You have different shape of the wave. You have different different frequency as compared to the targeted pimp, where you're looking at your peak, your duty cycle, your pulses. All of those variables go in to create a very unique waveform. Is it really a big difference? Yeah, actually it is. I was looking at a paper that you're going to have access to a little bit later from Jamie Gaynor, that what he compared it, he said that targeted pimp had a 7-fold greater effect than non-targeted pimp. That's huge. So what does it mean? What does it mean for my patient? It means you get a really efficient delivery of the field to the tissue so that you get a lot of beneficial effects with a very small amount of time. I'm going to go through 2 studies that show non-targeted pimp to targeted pimp. Now I can't compare them exactly, but the parameters are really, really similar. So this is a study, humans with osteoarthritis, non-targeted pimp. So these people, they treated 12 hours per day, and they had pretty good results, right? 25% reduction in VAS, visual analog scale for pain, and 26% of the patients were able to get off NSAIDs. That's pretty cool. 12 hours a day, and the pain score would go down from like 7 to 5, right? That's pretty good. Except when you compare it to targeted pimp. With targeted pimp, they treated these patients for 30 minutes a day instead of 12 hours, so 2 15-minute sessions, and the pain scale dropped by 50%. So now we take that 7, and instead of going down to 5, we're taking it down to 3.5. And they found with these guys that those effects, even once they stopped it, lasted at least 42 days. And you can say, well, maybe it's placebo. Actually, no, it's not, right? Because they looked at it and the sham units, they didn't have an effect. So when we look at targeted pimp, we want to think about what is it doing specifically. Here's a study from 2010 that looked at women that had breast reduction. They found that there was significantly less edema, there was less exudate, and in the exudate that they drew out, significantly less interleukin 1b. So what does that mean? We have less inflammatory mediators being produced. And again, about a 50% reduction in narcotic usage. Okay, again, we're talking humans, let's talk dogs. Here's a PEMF study where they took dogs, and for 20 days, they either treated them with twice a day PEMF device, or they gave them Previcox. And what they found was both of them did really well. The difference was when they stopped the therapy, the dogs that had been on Previcox pretty quickly started to have more problems. It came back, right? It was a short-term fix. Whereas the dogs that had been treated with pimp at 4 months and still at 12 months still had pain relief in place, right? Long-term effects. Other studies. I know I hate looking at rat studies, but they're so easy because when you do something to them, you know what to expect. So here's 2 studies. One looked at injecting an irritant into the rat's foot. You know how much edema you're going to get. You know how much pain tolerance you're going to have. What they found was the rats that were treated with the targeted pimp, significantly less edema and significantly less pain, or actually increase in pain tolerance. Another one, a little bit more objective, where they cut the rat's Achilles, sewed them back together, and then used pimp for 3 weeks, twice a day. Then they euthanized them, took the rat's Achilles tendons, and said, okay, if we attach it to a machine, how much pressure is it going to take to pop that puppy? And what they found was that rats that had the targeted pimp treatment, their tendons were 69% stronger, 69% more tensile strength. Right? So much more healing, less likely to get re-injured. Here's another beautiful one. Angiogenesis. These were rats where they took a flap. They put the yellow tube in, put the flap back. They treated some of them. They didn't treat the other ones. What they found, a 500% increase in neovascularization. To me, a picture is worth 1,000 words. We got it right there. Right? Also, what they found was the rats that had the targeted pimp, the flaps survived. The rats that did not have the targeted pimp, the flaps did not survive. Some more rat studies looking at pain tolerance here, 59% increase in pain tolerance. This one is looking at edema, 61% less edema than the sham group. All right, there we go. Next study, looking here, full thickness wounds. The rats that had the targeted pimp healed much faster. Here's the Achilles. It's just a visual for the same study. Let's look at some more dog studies. Right, this is brand new. This is 2018, 2-year study done by Dr. Olby at North Carolina State. Woohoo, I'm in North Carolina. They took dogs that had IVDD grade 5, so they're down. It was, again, a double-blind placebo-controlled study, right? Awesome. Nobody knew what was going on, which was which. What they found with the dogs was there was significantly less pain at the incision site, right? And not only was there less pain, but the longer the therapy went on, the bigger difference there was. They found that the dogs recovered proprioception faster, right? That's awesome. So we know that is helping to return function. And then really cool is GFAP is a marker for neurological damage. So the more GFAP you have, the more nerve damage you had. And the dogs that had the targeted pimp therapy had significantly less GFAP. Oh, so it's like neuroprotective. Another hemilaminectomy study. This was just done 2019, right? You can't get better than that. Dr. Leilani Alvarez in New York City at AMC, woohoo, amazing place. She had another double-blind placebo-controlled study and found that significant improvement in the healing at the incision site. Again, 50% reduction in opioid. So all of our patients that we would be thinking about putting on opioids, to me, this is a no-brainer that we should be treating them with this as well. And again, no side effects. So wake up. Here's another question for you. Tell me about your opioid usage. Do you not use opioids at your practice? You do? Are you affected by the opioid shortage? Do you worry that when you give out opioids that your clients may either sell or use some of those opioids? And would you like to migrate toward an opioid-free practice? I love looking at the polls. I love being able to see what other people are doing. Here we go. Wow, a third of you don't use opioids. Oh, and the rest of you do. Okay. 17% are affected by the shortage. Yeah, a third of you are afraid, right, that our clients may be using or selling the opioids that we do give them. And for those of you who do use opioids would like to decrease it. Awesome. Awesome. So any way we can do that would be a good thing. All right. So if we're looking to treat these patients, do we just think about arthritis? I put these up. I've highlighted some of them. I'll not going to read all of them, but I'd like to have some of them that you may not think about, right? Who would we be using these devices for? Arthritis, allergic reaction with difficulty breathing, right? Throw a loop over their head, boom, get it started right away. I have an 18-year-old dachshund. Anal glands are an issue, right? So anal gland abscess, all of our joints, arthritis, that one's like a no-brainer, right? Back pain, absolutely. Cerebellar abiatrophy. I recently had a colleague call me and said, hey, Laurie, can you help me? I have the diagnosis, cerebellar abiatrophy, by the neurologist. What do I do? Can I use an Assisi loop? And I said, well, is there inflammation associated with it? Well, from what I can look up, I think so. Try it. Pet got better, like immediately within like 2 days, right? Awesome. Cervical disc disease, cellulitis, all of our King Charles Cavaliers that are scratching at their heads, those guys, there's inflammation associated with that. That can be beneficial. Cholecystitis, cognitive dysfunction, right? As we get older, I worry about that too, right? Colitis. Every dog that has diarrhea may be having cramping, right? Whether it be upper GI, lower GI, we can help those guys. Conjunctivitis, corneal ulcers, right? How painful is that? Cystitis, think about all the cats, right, that come in and they're peeing blood and they're painful and they're screaming. Dental extractions, dilated cardiomyopathy, if we can increase blood flow to there, right, think about that 500% neovascularization. Tropion, fractures, obviously. FCE, get some more blood flow in there. Hemilambs, obviously we saw that. All of our joints, inflammatory bowel disease, if we can help those guys. Disc disease, kidney disease, granulomas, liver disease, neuropathies, nasal inflammation, oral ulcers, OCD, right? Not the people that can't stop worrying about things, right? Leg calf perthes, I've had great results with that. Laryngeal paralysis, huge. I'm going to cover that in one of our cases. Pancreatitis, there's definitely pain associated with that. Patelloluxation, pulmonary fibrosis, getting these guys breathing better. Seromas, targeted pimp devices are great for seromas. Spina bifida, yeah, you don't see it very often, but it's good to think about. Sinusitis, upper respiratory tract infections. I had a discussion with a vet who works at a humane society, and we talked about setting up a area like a playpen where she could put, so smaller than a playpen, put a clinica mat up on its side in a garbage bag with the cat's name written on either side, so she could be treating one cat on either twice a day. to help get rid of the upper respiratory infection, and then just switch the garbage bags as you treat 2 cats at a time. Urinary obstructions, again, we're going to hit that in one of our cases. Wounds, wobblers. Again, I'm not recommending one therapy. I'm recommending using a multimodal set and including these in what you do. One of the nice things is that targeted pimp can be used with laser. And when laser can't be used, like if you're doing stem cell or PRP, it can be used immediately without problems. Found a really nice study looking at people that had facial implants of fat, right, to look younger, and had significantly less failures and significantly less pain and inflammation. They actually started the PEMF treatment before they did the fat injections and found a increased survival of the proteins in the tissue. So what do these devices look like? The targeted PEMF loops can come at 10 and 20 centimeters. You can have some that are on demand where every time you push the button it comes on. It's on for 15 minutes, shuts itself off. Clients can use it 1 to 4 times a day as needed. They have at least 150 uses. I personally have had a client who checked off and got over 190 uses. You can have the auto cycle. You do an amputation, you do a disc, and you want to have it on every 2 hours. You wrap it right into the bandage, you hit the start button, and it goes off 15 minutes every 2 hours, and they guarantee at least 100 uses. Is it hard to use? No, you find the area of pain. You figure out, think about the field. Really, really important. Think about the field. Know that you're putting the area that you want. And obviously, by the coil is going to have more therapy than at the very end of the field. So wherever it's most important to have the therapy, you want at the center of the loop. When the light goes off, you know the treatment's done. A lot of times I have patients, like if they have a dog with wobblers or disc issues, that we use it 4 times a day for 10 to 15 days and then drop it down. And then you know what? The dog's going to go play at the park. Hey, before we go or as soon as we get done with playing, throw the loop on, click go, less likely to have a problem afterwards. The lounge is great because you can just place your pet gently in the carrier and zip them up or not zip them up if they're comfortable being in the carrier. For my dachshund, we zip them up. And he sits in there, he's quiet, he's happy, he sleeps. My timer goes off and I take him out and he's happy. So this is the Atom and the Air lounges. It has treatment from the whole bottom, 8 to 10 inches up, so you could treat almost the whole animal or the whole animal. There's a new pad. It's 18 inches by 36 inches, recommended for in-hospital use. Think about every patient that comes out of surgery can be recovered on these. Instead of having 150 uses and you have to wait 2 hours between uses, which is what we send home with our clients, I can go patient to patient to patient to patient. I may have to recharge my battery, but my battery has 6,000 uses and I don't have to wait 2 hours in between. I can also put these in my exam rooms so that every patient, when they're waiting for the doctor to come in or after the doctor leaves, the patient can be treated. Or you can treat the patient while they're on there. The times that I wouldn't do that, again, if I'm using the laser or if I am doing electrical acupuncture, because I don't want to have either therapy affect the other one, and we don't know if it would be for the better or for the worse. For your patients who are antsy, I can't sit still, I got to pace, I got to move, or the client who can't sit with their dog for 15 minutes to hold the loop. There are wearables where you can actually Velcro loops onto the dogs so that they can stay in place. So let's go through some cases. Autumn is an 18-year-old cat. She was diagnosed with osteoarthritis 3 years previously, had rehab. It was helping, but it wasn't enough. You'd scratch her back and she'd meow. We got her on using the loop, and she is still doing it 3 times a day. And when we started that, within 2 to 3 weeks, she was a whole new cat. You could rub down her back, you could rub her ears. She was friendlier, she was more active. Much, much happier cat. Oz, great case, urinary tract obstruction. Went Western. Was anesthetized, catheterized, given sub-Q fluids for 2 days. All right, everything's good, right? No, 2 days later, he blocked again. So rather than going through that again, a loop was used. Within the 15-minute treatment time, he started dribbling urine, right? Went to express his bladder. Oh, wow. Instead of him being blocked, he was easy to express. The client to this day is using it twice a day, and we have not had another problem. Now, he's still on meds, but he's doing great. He still was on meds. Cabo. Cabo is a great case because here he is, this cat, and we see this all the time, recurrent sinusitis, rhinitis, otitis. He had been a rescue cat, came in from a hoarder house, 12 years old, approximately. Every couple weeks, he'd get this thick, yellow, snotty discharge. He'd get treated with antibiotics or anti-inflammatories. He'd seem to get better. We'd stop. 2 weeks later, he'd come back. Started using the loop sporadically, maybe a little bit better. Started using it 3 times a day. Wham! No more drugs needed. No mucopurulent discharge needed. Cat is so much happier, better quality of life. Reuben, near and dear to my heart. This was like almost like my stepson. This was my assistant's dog, my personal assistant's dog. I love this dog. From the time she adopted him, he was with me. He literally stayed in my office. Great, great case. 10-year-old golden retriever had 5 knee surgeries. Luxating patella, fail. Luxating patella, other patella luxating. Cruciate on one side, cruciate on the other. Oh yeah, and by the way, he had hip dysplasia, he had elbow arthritis, he would have muscle issues with his shoulders, he would have neck pain, he had LARPAR at the end. He would go out, this was in Chicago, right? A hot, humid day, walk out just to use the restroom, well, the grass, and he would have trouble breathing. We got a loop on him, and literally within a minute, he would stop having troubles breathing. It got to the point that he would have the loop put over his head before he went out. Even in the heat of the summer, he didn't have problems. Laura would blog. She was into all kinds of social media. And what she found out was she was not the only one, or the only client that had a dog with laryngeal paralysis that used these targeted pimp loops. It was actually written all over that clients would go to their vet and say, hey, listen, I heard about this from this blog. Can you get them for me? Awesome. Awesome, awesome, awesome. I love it when people are talking about therapies that can be beneficial. All right, one of the other things I wanted to put this up for was because he had lots of issues. So you can see one of the older loops here. She had lots of loops because she didn't want to wait and every 2 hours be putting another loop on them. So she would treat one area and then treat another area. Now, if you're using multiple loops, what you need to know is you can't put one on the left hip and one on the right hip and turn them both on, because the fields will cross. And again, it's going to have an unknown effect. So you may actually be canceling each other out. But as long as there's at least 6 inches between the loops, between the treatment fields. You can be treating the hip on a large dog at the same time you're treating an elbow. Okay. Also think about this. If you've got two hips, you can be putting it at the back end and be hopefully getting dogs small enough, both hips at the same time. Or you can lay them down and put the loop between and treat one knee above and one knee below, or one carpus above and one carpus below. And this is Reuben at his 15th birthday party. He was a rock star. His mom loved him dearly, and the targeted pimp loops helped his quality of life tremendously for the last 5 years. All right, Fritz, 18-year-old dachshund, has gone through 11 teeth pulled at one point, 14 teeth pulled 2 years later. He went through cervical pain, where he was a day away from going in for the myelogram and surgery. MRI and surgery. Acupuncture, you try putting even a sarin needle in this dog and he turned into a piranha. Chiropractic, he couldn't get close to his neck. Even with massage, he was very sensitive. Laser helped, was not stopping it. When we finally started adding the loop to it, was when he could finally relax. And again, it was four or 5 times a day, but it was enough to get him past the point of pain, so we didn't have to have the surgery. Later on in life, we used it for anal glands. Didn't think you really needed a picture of a dog with a loop around his butt, but I'm sure you can imagine what it looks like. Here we go. We have pictures of him after his dental extraction, and as well as his cervical issues. Think about the treatment area and you'll know where to put the loop. Kiss. Kiss is an extremely competitive 4-year-old agility Sheltie. Came in, wasn't doing as well as he should be, having lots of issues. When we did his exam, right medial shoulder instability, bicep brachii issues. He had an iliopsoas strain, also on the right. Both gracilis, huge trigger points, right? So think about this. You say, well, is that important? Yeah, well, gracilis is one of the main muscles of propulsion. So when you have a trigger point there, you're not able to stretch it. So you're not getting a full contraction. You're not getting a good full stretch. So you have less propulsion and a shorter stride. So for a competitive dog, huge, huge problem. And he also had wrist issues. This picture is after we treated him. Now, it's not like we did nothing besides the targeted PEMF loop, but it was a big part of his therapy. His owner was very religious about using it 4 times a day. We used it over the shoulder and bicep brachii area. And he's a Sheltie, right? So we can lay it over the shoulder and actually get the other one too. Because if one side hurts, we're going to be overusing the other side and increasing the chance of an issue there. He's small enough that we were able to take the loop and slide it up into hula hoop position, right? So we could treat his back, we're getting his spine, we're getting his whole iliopsoas, it would be getting the hips. We were able to use it between the front feet, so we were able to do the pulsed electromagnetic field therapy for both of his wrists. Again, anytime I'm treating one side, I worry about the other side may have issues, and if I can fit that in the field, woohoo, that's great. So now, this was a direct quote from his handler, owner, mom. She emailed me. He did his double qualifier, masters and standard, in the fastest time he has done in over 1.5 years, and that's in yards per second. And he won his premier standard class. Premier is a harder class than just the regular standard class. So Kiss is doing awesome. All right, not just about dogs and cats. Really cool. The targeted PEMF devices were the only pimp devices allowed at the World Equestrian Games. So in 2018, the games were in Tryon, North Carolina. Horses flew in from all over the world. And Dr. Steve Adair from University of Tennessee was there treating these horses with these PEMF devices. Very, very lucky horses. I mentioned that I was going to give you information on the Jamie Gaynor paper. Here you go. So you have access to the paper, not only through this link, but also through the Assisi website. It's, I don't know, maybe 8 to 12 pages, but it is a great, great paper if you want to know more about the science behind pulse electromagnetic field therapy. And again, this is brand new. This was 2018. So more reading, homework for you guys. So in a nutshell, what are we looking at? We talked about both targeted pulse electromagnetic field therapy and laser. Both of them can reduce pain. Both of them can increase mobility. Both can improve circulation and accelerate healing. Both can reduce swelling. Targeted PEMF, we have no side effects. We don't have to worry about heating, burning, slowing down nerve conduction. And we have the effect that it is opioid sparing. In both humans and dogs, really good studies showed 50% reduction in opioid usage. Awesome. So back to you guys. Hope you're awake. Let me know. Are you interested in what we've had to say, but you're going to stick with what you know? Are you interested in trying some PEMF in your clinic? Are you interested in trying some laser in your clinic? And do you think that you may be able to use this to decrease your opioid usage? So pop in your answers so I can get an idea of what you guys are doing. And for those of you who are listening to this after the live event, you can also send in questions and we'll take care of you. All right. Awesome. So it looks like 81% are looking at trying PEMF. Awesome. And trying laser, 30%. Wonderful. At least half of you guys want to decrease opioid use. Guys, it's a game changer. It's a really great thing. Coming from a person, my own golden retriever had a osteosarcoma. We did a partial amputation and had a prosthetic on him. Being able to decrease opioid use is a great thing, right? The Assisi loops help tremendously. All right, so you guys get race approval. You get a credit for this. But in order to get that, you have to let us know that you have watched the video. So within a week, you have a week to send in your evaluation after you watch it to get your race approval. And again, you can at that point type in that you want to get the questions and answers and they will be emailed to you. I hope you guys have had a great time. Hope you've learned something. Hope you had fun, and I look forward to answering your questions. Have a great night, everybody.